There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.
There's an easy way to protect
of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good morning to those who are watching and who might tune in at a later time. I have news today. You're going to hear from Dr. Hudson, Dr. Ruiz, the coroner, Mr. Allen. One consistent theme I think you'll hear is that while the numbers are down somewhat, the infection rate, the number of hospitalizations, and the positivity rates are so high that we need to continue to be vigilant at this time. I want to thank the city manager's office, the IT department, got this information together for me. I think it really illustrates where we have been, where we are, and where we're going. But also, I need to thank the people at Phoebe Putney. We'll see the hospital statistics, and I hope I don't step on Dr. Hudson's toes here, but I have some of that information as well. First, we have explained that the city manager's office collates all the testing information from the various sites in the community. This represents the results, the biweekly results. The sites would be Albany Area Primary Health Care, Phoebe Putney, the Health Department, and then private providers who are testing, including Albany Internal Medicine, One Source. A few of the providers don't regularly report, but their numbers are not that high. What we can see is we know that there was an uptick in January and February. The numbers started falling in mid-February, kind of leveled off, and then there were some of us who in June and into the month of July thought this thing was largely behind us. We now know that was an inaccurate assessment. The numbers start trending up in July, the middle of July. You see the fallout after July 4th, and then this week, the 2-week period, July 26, 2021, we are up to 243 positive cases at 2 weeks. 2 weeks later, on August 9th, the number has more than doubled. And then again, 2 weeks after August 9th, on August 23rd, the number of infected persons has doubled yet again. But the problem here, and when I want to say, we're going to talk about earlier, the numbers coming down, when the threshold of the doubling of the numbers is 671 as opposed to 243, you have 4 times the number of people who are infected. So the last results we have are from September 6th. You will see that even though we had an increase in the number who was of positive cases, there was a significantly higher number of people being tested. Which the good news, and it's not great news, but what you see here is the positivity rates during these 2-week periods. Again, early in the year, we were up in the mid-teens. At one time in January, it got up to 18%. We see what I was referring to, the numbers doubling between 7/12 and 7/26, and then doubling again from 7/26 to 8/9. The positivity rate throughout the month of August was right around 22%. And what we have seen in the last reporting period is a decrease, not a substantial decrease, but there again, we see it falling from 22% to 19%. Hopefully, people are being more cautious, but what I see on television and indicates to me that we have, again, large people congregating and very few maintaining social distance and taking other precautions, such as wearing masks. We do know that some local school systems have suspended in-person instruction due to high rates of infection in those school systems. And I would like to say, I would commend the Dougherty County school system for throughout this entire pandemic. The administration at the Dougherty County school system, like Albany State and Albany Tech, have followed the numbers and taken the precautions to protect their students, and one of those things is simply requiring that students wear a mask, which I'm somewhat perplexed that this is such a controversial issue with so many school systems. But moving forward, these are the numbers from Phoebe Putney Health Systems, and I think this is going to be all 4 hospitals, which would include, in addition to Phoebe Putney and Phoebe North, Phoebe Sumter, and Phoebe Worth. What we see here, again, in the last reporting period on September 5th, you start seeing a decline from 822. However, the one thing I want to point out here is the dark blue represents the numbers of patients who are in the intensive care unit. And while I don't have the specific percentage of individuals, the mortality rate, in other words, the people who are on mechanical ventilators and do not survive, we know that that is a significant number, which tells us you see these numbers when the dark blue begins to collapse. There's also going to be a coinciding high number of deaths with that. And we have seen it this month and last month. There have been a substantial number of deaths in the hospital, and that is directly related to the people who are in intensive care, indicated here by the dark blue. Again, this map, Phoebe Putney's tracing the county of residence. We see Lee County has actually more than Sumter County. Worth County has, in the last few weeks, had a high number of individuals who are admitted to the hospital. Ethnicity, we know that in the early months of the pandemic, we had an overwhelming disparity between African American and other groups, particularly whites. That is somewhat leveled out. Here you see that Caucasians represent fully 46% of the patients who have been hospitalized. This is not positive results since July 15th. Gender, consistent with what we've seen, except again, I think there was a higher disparity in female originally, but we know there are more females in the adult population. Now this is a telling graph right here. What this is showing in the blue is the percentage within an age band of patients who were admitted between March 1st, 2020 and July 14th, 2020. The orange band is the number of patients by age group admitted since July 15th. What you see here is what your speakers have been telling you throughout the last few weeks. We're seeing a younger population who are, again, not necessarily testing positive, but who are requiring hospitalization. Particularly if you look at the age group 40 to 49%, until July 15th of this year, that group represented only 10%, whereas now it is 16%. Those between 30 and 39, we actually have about a 33% increase from 9 to 12%. Conversely, on the other side, from patients who are 60 and older, you see a drop, not as dramatic or pronounced in the 60 to 69 range, but certainly significant in the 70 and older. And the reason for this is obviously these individuals have a very high percentage been vaccinated. This next slide is death by total. Again, what we see here, particularly in that 40 to 49 age group, is a substantial increase in the number of deaths of younger patients. It has increased more than threefold since July 15th. This, if no other reason, should tell young adults why they should be vaccinated. I hear time and time again of people who are on ventilators, who refuse to be vaccinated, and those who are coming out of the hospital, the first thing they're doing is telling their loved ones to get vaccinated. It shouldn't come to this. The last few slides are from Phoebe Putney. They're going to show us this decline. It is not a significant decline. Phoebe Putney, the two local hospitals, maintain what's called a census every week. That is the average number of COVID patients who are in the hospital. As we talked about previously, the numbers were at their highest in the month of August. You see that August 14th, 108, the average census jumped up to 146 in 1 week, and then the next week, the week of August 28th, it was at, I believe, its highest since the beginning of the pandemic. There were an average of 164 COVID patients in the two local hospitals every day. We see that in the last week, the last report we have is September 4th, the number fell down to 145. But again, let's put this in perspective. If we see we have 145 patients in the two local hospitals, that is far beyond the number that would allow the hospital to continue to operate with any degree of normalcy, because we know, we've heard the medical professionals speak as to the increased demand when you have a patient on ventilators. The medical staff is working tirelessly and valiantly and should be commended. I think we probably don't recognize the healthcare community as often as we should, but also when we hear Mr. Allen, we hear police officers. When public servants come into contact with people who are or may be infected, they have to take additional precautions, and putting on a hazmat suit, cleaning a cabin, cleaning the interior of a patrol car. This requires a great deal of investment of time and effort. The census, the next is going to show us again what you're seeing, the overwhelming number of patients who are testing positive have not been vaccinated. I believe throughout this spike since July 5th, I think the number is about 85% of the patients who have been admitted to the hospital were unvaccinated. That, again, is yet another compelling reason. And here The number of deaths since July 15th should be enough, another wake-up call at the two local hospitals. You see there have been 75 deaths. And 20 of those deaths have been people who are 60 and younger. And with that, these kind of gruesome numbers, I would hope, enlighten the community, but more importantly than that, I think it should impel those of us who have not been vaccinated to do so. Thank you, Chief.
Thank you, Mr. Mayor. Very informative presentation this morning. Very well received and very well presented. We'd like to move now and hear from our representative from Phoebe Putnam Memorial Hospital. Dr. Kathy Hudson is here. She is the Chief Medical Officer for Phoebe Putnam Memorial Hospital. Please come right in.
Good morning. So, has already been stated, we have seen a significant decrease in our total number of patients admitted to the hospital over the past several weeks. As you can see from the slide, back in August we had a peak of 214. We are down to 162 today in our Phoebe Health systems. That's a 24% decrease. You can also see, though, that as the mayor pointed out, there is a big difference in our total admissions and our ICU admissions. As you can see by the light blue, that's the total admissions. It's trending down nicely, but the dark blue is widening. We are having more patients in our intensive care unit. Today, we have 60 patients in the intensive care units, 49 of which are on ventilators. Our overall numbers, again, are improving. Albany has 133 patients today. Phoebe Sumter has 22 in Americus, and Phoebe Worth has 7 in Sylvester. The patients in the intensive care unit are critically ill, and we're doing the best we can to provide the care for them and help them recover. But we know that some of these patients are not going to make it. This month alone, we've had 22 deaths in our health system. We still are admitting a fair number of patients every day. The numbers are still significant. We had 12 admissions yesterday in Albany, and 2 in Sylvester, and 6 in Americus. So those numbers are still staying fairly high. It is true that we do have some patients in the hospital that have been vaccinated, but the vast majority are unvaccinated individuals. So the bottom line is everyone needs to be vaccinated, because it does help protect you from the virus. It helps prevent serious illness if you receive COVID-19, and it prevents the hospitalization, mechanical ventilation, and death. You can still get vaccinated at a Phoebe facility by calling 229-312-MyMD at one of our clinics. Or you can also go to phoebehealth.com and find where the mobile wellness clinic is, administering vaccinations. One thing we have done this week that we're quite proud of is opened up a COVID-19 Advanced Care Clinic. It is across from the emergency department, next to the community care clinic, and it is our effort to expand monoclonal antibodies. And I've talked about this before. If you do come down with COVID-19, you receive a positive test and your symptoms are mild, you do not require oxygen, within 10 days you can receive monoclonal antibodies. It helps your body start fighting off the virus before it can make its own antibodies. So we have expanded that. Wednesday we administered 70 doses of the monoclonal antibodies here in Albany. We're also working to expand to another temporary building in Americus to expand that capability. It does help prevent the progression to severe disease and hospitalization. So your doctor can refer you for the infusion, or you can also call 312-MyMD to get scheduled for the monoclonal antibody infusion. It is free of charge. You would not be receiving a bill, because we know that it helps. The first line thing should be get vaccinated. But if you do come down with COVID, please ask your doctor about the monoclonal antibodies. The Phoebe family would also like to acknowledge the 20th anniversary of 9/11 this weekend. The country came together in a tragic event. We all worked together at that time, and that's what we need to do now. In remembrance of what we did 20 years ago, we all need to work together to fight this virus. So we all need to do our part, which includes get vaccinated. It is your best prevention of being hospitalized with COVID. And if you do become positive with COVID, please inquire about the monoclonal antibodies. I'd also like to thank the support of our communities, to our frontline healthcare heroes. We are stretched thin, we're all exhausted, but the support and love we receive from our communities makes it all worthwhile. So thank you.
Thank you, Dr. Hudson, for being here today, presenting on behalf of Phoebe Putnam Memorial Hospital. Our next presenter is the Director of the Southwest Georgia Health District, Dr. Charles Ruiz.
Thank you, Chief Scott. During the past 14 days, there have been more than 1,000 new cases of COVID diagnosed here among Dougherty County residents. So that's more than 73 cases every day in this county. One of the responsibilities of public health is to investigate every case of COVID. And as I say, that's more than 73 new cases that we investigate every day. During the investigation, one of our goals is to try to ensure that the patient knows that they are positive and that they have an active infection. We do what we can to educate that individual on the rules of isolation and the duration of isolation. Another purpose for that investigation is to ascertain how many people have been exposed and to find out who they are, and then the next step is to contact all of the folks who have been exposed as contacts. We talk to them to make sure they know they are in that category and that they need to quarantine and so forth. So literally, it's our goal to have a conversation with every person that has COVID. During those conversations, we learn quite a lot, and many times we learn that the sick individual was exposed to someone who knew that they had the symptoms of COVID. And instead of staying home and isolating, that sick individual went out into the community and exposed other people who became sick with COVID. So it's kind of a vicious cycle that goes on and on. There are some times when a person is contagious and they don't know it, and there's no fault assigned to that individual in that case, even if they spread it. But we know from months and months of experience that many cases of spread occur because an individual knew that they had symptoms and yet did not isolate. With that in mind, I would like to review the symptoms that we attribute to COVID. So if you hear any of these symptoms that you have today, we want you to isolate and continue to isolate for at least 10 days unless you have an adequate test that essentially rules COVID out. So I like to read these symptoms. You've probably heard them before, but let's review. All of these are symptoms consistent with COVID: fever or chills, cough, shortness of breath, fatigue, muscle aches or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If you have any of those symptoms today or in the future, we need to be concerned that that could be because of COVID. You need to isolate, set up a test to rule out COVID, and consult with your healthcare provider. That's a very important thing that we can do to help reduce the spread of COVID in the community. As I said, we have had over 1,000 cases in the last 14 days. That's a high rate of spread. Even though we are seeing some communities where the numbers are not as high as they used to be, this is still a very dangerous environment. We are in a fight against this virus. This is not over with by any stretch of the imagination. We need to do what we can to protect ourselves and to protect our community. So I'd like to review those things that we know will help. I'm not saying that if we follow these recommendations that we can avoid COVID 100% of the time, but it puts the odds in our favor. It helps to reduce our risk of getting an infection. It helps to reduce our risk of being in a hospital, and certainly reduces our risk of dying from COVID. You've probably heard all of these before, but number one is get vaccinated. If you have not been vaccinated for COVID, if you're 12 years old or older, you're eligible. We urge you to get vaccinated as soon as you can. Practicing social distancing will help. The virus, as a rule, does not just fly through the air. It commonly goes from one person to another through coughs and sneezes. Staying 6 feet apart will help reduce the chance that you could inhale a droplet of secretions from another person. Wearing a mask puts a barrier between you and a person who might be sick with COVID. So wearing a mask can certainly help reduce the chance of transmitting COVID. And finally, practicing good hygiene, keeping your hands clean, cleaning hard surfaces with disinfectant. If we do all these things, we might wind up with COVID. But if we do all these things, we greatly enhance our chances that we can avoid COVID and that we will not be hospitalized or die from COVID. This pandemic is not over. People are still getting sick and people are still dying. So we want to urge you to make the right decision, do what you can for yourself and your family and your community. If you are looking for a place to get a vaccine, the health department in Dougherty County, in fact in every county, offers all three of the vaccines. The number to call for the Dougherty County Health Department is 229-638-6424. That's 638-6424. Call today. If you need a vaccine, they would be happy to either vaccinate you today or set you up an appointment for Monday. Thank you very much.
Thank you, Dr. Ruiz. We will now hear an update from our Dougherty County Emergency Medical Services. The director is here today, Mr. Sam Allen.
Thank you, Chief. Good morning, everyone. You're going to hear information today from Dougherty County Emergency Medical Service, and it will support the information you've heard from the mayor, from Dr. Hudson, Dr. Ruiz. The numbers are still high. Again, we've seen a slight, and I used the word very slight decrease, but it's not a safe decrease. It is only slight. This slide shows the volume from January 1 through September 9. You can see our call volume is still very high of COVID positive patients that we're seeing out in the streets, in their houses, their business, and we're transporting these patients to Phoebe for treatment. Here's a little more definitive scale that you see. The line is still high. So again, please take every precaution that you can. It is still dangerous. It is still deadly. Keep in mind, the original COVID virus spread from one person to relatively two people. With COVID, with the Delta variant, is spreading from one person to 6 people. So it's much easier to spread the virus. Here you can see our call volume and percentages. And we started in June, and I'm going to talk about the holidays. That's when, about 3 weeks after a holiday, we start seeing a spike. We just got through the 4th of July, where we just hopefully have spiked on that one and come down just a little bit. But again, we're just now hitting Labor Day. So we're looking at where we're going to be in 3 weeks. This is why it's very important that you get the vaccine. The vaccine is here. It is safe. Please take advantage of it. If you have questions about the vaccine, go to the CDC website. Talk to your doctor. Get informed information about your health with your doctor as to whether or not your doctor recommends that you take the vaccine. We strongly ask you, please consider every option and look at taking the vaccine. Make informed decisions, not what you read off of social media and comments from other people. Follow the facts. CDC, your doctor, and make a good informed decision. So with Pfizer, the shot is given, you wait 21 days, and then you take your second shot. Then after 2 weeks, you're fully vaccinated, okay? Yes, some people have gotten the vaccine and they've tested positive. In some cases it happens, but you don't see the severity in the patients look at the numbers. 15% of the people at the hospital were vaccinated, 85% were not vaccinated. What if we turn those numbers around? 85% vaccinated and only 15% in the hospital. We would save a lot of lives. With Moderna, it takes a little bit longer. It's 1 week longer. And this is where I'm going with this. We're in a time frame right now. So the Moderna, when you take the shot, you wait 28 days, and then you take your second shot, and then it takes 2 weeks after that to get your vaccination to where it needs to be. So we're looking at a time frame. Here's a schedule, and I want you to look on the left. If you get the shot on September 13th, and you take Pfizer, you take your second shot on October the 4th, and you won't get your protection level up until October 18th. Please keep in mind, we've got more holidays coming up. Don't wait around. If you take the Moderna, you get your shot on September 13th. You'll take your second shot on October the 11th, and it will then be October 25th before your vaccine is in your system and ready to fight off the virus. So the countdown is on. You've got 52 days before Halloween. You've got 77 days before Thanksgiving. Keep in mind of the days that it takes to get fully vaccinated. Don't waste your time, and think about it and talk and make informed decisions, because we don't want to see anybody else that's infected with this virus succumb to it. Far too many people have. It is still dangerous. It is still deadly. We strongly encourage you, please get the vaccine, reach out to other people, and get them to make informed decisions. Talk to their doctor, go to the CDC, look at all the information, and take the vaccine. It is safe. I've taken it back in December, and I'm fine. Yes, you're going to be a little bit sick when you take it. That's normal. That's your body fighting the resistance, and it gets in there and protects you. So, thank you.
Thank you, Mr. Allen, for your report today. Those who are on the front lines and handling our community from the very onset and getting them to the hospital. So thank you very much for providing that update today. We will now bring up the Dougherty County Coroner, Mr. Michael Fowler, for some remarks.
Good morning. I want to go over a few stats with you and let you know where we're at for the last couple of weeks. First of all, it's been mentioned already. I don't want to forget the families and the first line workers, first responders during the 9/11 20 years ago. So we need to keep them in prayer still. We have had 326 families, 326 deaths, 326 homes been affected by this virus, Daughter County residents, and it's still growing. Since the last press conference, we have had 8 more deaths. Last week we had 318, we're up to 326 right now. By gender, we have a total of 175 females. We have 151 males. But last week, I was telling you about race. Last week we had 7 blacks and we had 6 white. This week we have 100% black. All 8 are black that died from the virus in our community. 8 homes that have been affected by this virus. If you do it by last week we had 4 in the age of 70. We had 5 in the age of 60. We had 1 in the age of 50, and we had 3 in the age of 40. This week, just from September the 2nd to September the 9th, we've had 1 death in the age of 80. We had 3 deaths in the age of 60. We had 3 deaths in the age of 40. And we had 1 death in the age of 30. And this is the death from the last year on top. This is where we started from this year back in March. We had 5 deaths. We had 3 deaths in April. We had 3 deaths in May. We had 2 deaths in June, 2 deaths in July. August, we had 29 deaths in Daughter County residents. As of September, we have had 9 deaths so far in the month of September. I want to remind you again, remember, 1 person can go and infect a whole entire family. If 1 person decides not to take the vaccine and be at home around your family, you can affect each one in that home. Your immune system might be stronger than the person that's in your home, but you can affect them. So I want to say, listen to what the science is saying, what everyone has said today. But I'm a realist, and I want to say this, and I say it from the bottom of my heart because we've been preaching this message over and over again. You got to make up your mind what you're going to do. It's simple to get tested and get the vaccine. It's very simple. If you don't have this to happen, you can wind up like this on a ventilator with all these machines hooked up to you. You don't want to see your loved one in the unit that you cannot get to. They're hooked up to all these machines. Just think about you laying there, unresponsive, or your loved one on a ventilator trying to breathe. I want to say, if you don't get the vaccine, then the doctors already said, if you get the vaccine, you less chances of winding up like this. But if you don't, the next step, this is the place you don't want to be. You don't want us to come in to your home or go to the hospital and be carrying you to the mobile morgue. We have not put one in the mobile morgue yet, but this is where it's headed. If you don't get the vaccine, do you want your loved one to be going to the morgue? So I would encourage you, we need to stop playing games. Let's be real. I want to say it for real. I can say it. Our black community have been affected hard. So there should be no reason why a veteran shouldn't get the vaccine. When you went in service, you didn't ask what was in the shot. You got all kinds of shots to go across sea. You got shots. You didn't ask what was in it. Years ago, when we were getting polio shots and all kinds of shots, you didn't ask the doctor what was in it. You took it because you trusted scientists. Why we can't trust the scientists now? Again, there's 326 families in Daughter County have been affected by this virus, and then still people don't believe. It's getting tiresome for us to keep coming up saying the same thing every week, and people are still saying, well, I'm not going to do it. Then I guarantee you, if you get a mic and go to the ICU unit right now, ICC unit right now, and get them to testify that's on their bench right now, they'll tell you to take the vaccine. Because that's a bad place to be. Then sometime if you do come out, the aftermath and the effect that happened to you while you was in the hospital. So I want to encourage you to think twice and get up and do something about it. Because I don't want to be coming to your house, carrying you and putting you in the morgue. Thank you.
Thank you, Mr. Coroner, for your remarks today. I want to share something that's been shared with me, and I was asked to share it today, but Dougherty County will be sponsoring an incentive-based vaccination event next Saturday, September 18th from 8 a.m. to 1 p.m. behind Albany Civic Center. We will be partnering with Phoebe Putney Memorial Hospital, the Department of Public Health, and Albany Area Primary Health Care to administer all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson. Walk-ups are welcome as well. No appointment or pre-registration required. There will be some information going out later today with more of the details, but please take note of that event, incentive-based vaccination event next Saturday from 8 to 1 behind the Albany Civic Center. Before we end today, I will want to thank all of our presenters today for being here. I would be remiss if I did not mention tomorrow being September 11th. This country was affected forever. I commend the efforts of those who are around the community, who are putting out flags, and who are not allowing those lives lost that day to not continue to be remembered, the great sacrifices that were made that day, public safety, the families, people still affected by that loss today. So I stand before you today as the fire chief of this great community saying thank you for continuing to remember September 11th. With that, I will turn and see if we have any questions today. There are no questions. We will call our press conference to end today, and we'll see you next Friday here at 10 a.m. Thank you.
There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.